The day that he had passed away, the nurse was tube feeding him. Well, you're supposed to gravity feed, and she had plunged the food into him, and it went up into his throat and into his lungs, and he started to choke. And he had asked for help. He wrote on a piece of paper that he wanted the vacuum. And it was actually the suction that he was requiring. And the nurses, it's hard to tell the whole story, but they were trying to get the suction working behind the bed, and it wasn't working. So there were two nurses trying actively to get the suction working behind one bed. It wasn't working. Behind the next bed, it wasn't working. It was taking forever for them to call Code Blue. My mother was crying, saying, we're in a hospital, equipment's not working, what's going on? My father's like, you could see in his eyes, he's asking for help, please help. Help should have been immediate, and equipment should have been working and functioning, and Code Blue unit should have been able to respond immediate. And
he shouldn't have had to die such a horrific death. He was fully cognizant, he was fully aware what was happening when he died. He shouldn't have had to die like that.
Right, like if you could imagine yourself choking to death and just like nobody's coming, nobody's helping, like.
Well, Earl's family deserves some justice and some clarity, but more importantly, we have to stop this from happening for other families. And that's I know with all the families who have come forward, yeah, they're concerned about their loved one, but they're also concerned about making sure that we pay attention to what has happened and then fixing these systemic problems.
A review was done. It was deemed to be a critical incident. And from that, the region has made some changes to their practices. So they've made some changes to how orders are written when it comes to feeding tubes. They've also made some changes in how feeding tubes are administered by the care aides as a direct result of this case. And that would be information that would be then shared with the health region and with the health region, with the ministry, and then potentially with other health regions, depending on whether or not the issues that they identified are unique to this situation or whether or not they would be applicable to other health regions. So they have made some changes based on this issue.